Now, on this CD, we've talked about bad-mouthing the allopathic profession, etc. And I didn't want to just leave this CD without giving some suggestions for a new type of therapy. And this discussion that we have here in the proper medical therapy, which I call the Nelson therapy, is something that is much more discussed on many other of our tapes. And here I just want to touch on it briefly so that we can go through this real quick and understand. Basically, I'm looking at a proper medical treatment plan and a proper way of dealing with a case, whatever the case might be. And when the case comes to me for whatever disease it might be, I want to look at the cause of the disease. And not just cause, singular, but causes. We must deal with the causes. It would be irregular thinking for us to assume that there's any person without multiple causes. It is such a complexity. What are certain of the causes? Stress, major problem in life. Lack of awareness. Lack of awareness is different than stress. Lack of awareness might be lack of education. You might not know that white sugar is bad for you. You might not know that you need to drink more water. You might not know about exercise. You might not know about the over-processed carbohydrates, etc. You might not know about those things. Education, as well as not being aware of your body, not really being aware of what type of clothes that you need to wear, how to handle your body, listening to the internal awareness. Heredity, of course. We can inherit bad genes and have a tendency towards different types of diseases. Allergy, mental factors, excess greed, excess anger, excess fear, anxiety. These mental factors can create disease, not just in and of themselves, but they can affect biological function and create other diseases. Toxicity, vast, untapped, really unresearched field of disease. Trauma, of course. Micro trauma, small little trauma, as well as mega trauma, falling off a building, hit by a car. Pathogens. We want to deal with the immune system naturally, but we have to realize that pathogens are a cause of disease. Perverse energies, microwave, etc., but the original perverse energies to the acupuncturist were cold, wind, heat, humidity, these type of things, and how they impinged on the body. But now we have to add new ones, as we have gamma rays and X-rays and many other types of things. We have radiation coming off of our color televisions. Of course, there's been much improved since the old days. Back in the 50s, these things we could measure ionizing radiation. Nutritional excess or deficiency, and we must put this down as both our potential causes of disease. It is not just, many people have too little vitamins. Many people have too many vitamins. And you can get just as sick from too much as from too little. Moderation in all things, as our friend Ben Franklin once said. Once we deal with the causes of disease, once we get the nail out of the tire, this is the nail in the tire, we still got a flat tire. So psychologists, they go back down the road and look for the different nails. Oh, hey, look, we found the nail. Great. But you still got a flat tire. It's important to build a system of medicine where we restore health to the damaged organs. In homeopathy, in our system of sarcodal homeopathy and glandular research, we are trying to restore healthy function to organs. Something which the medical profession doesn't really do. All they really do is mostly allopathy. And restoring function is something that they're just not taught. They're taught how to deal with symptoms and disease states, how to manage a case, not how to restore health. So restoring health to an organism is a deep part of medicine and should be concentrated. I believe this should be 50% of the educational process. And in the traditional medicine, it's less than 1%, if that. Unblock the blockages. Chiropractic, acupuncture, osteopathy, all deal with unblocking the blockages, whether it's blockage in nerve flow, blockage in air flow, blockage in acupuncture meridians. But let's add psychological, because there might be psychological blocks between you and your family and your friends and your workers, etc. So we want to unblock the blockages of all these different things. We want to deal with the symptoms naturally. Symptomatology must be dealt with. Allopathy is a part of our system. It is not the only part of the system. Allopathic medicine, we need to deal with the symptoms, but we must deal with them naturally at the first intervention. If we cannot control the disease state in the early intervention, we might have to go to those synthetic drugs. There's a time for all things under heaven. So we have to realize that we might want to use those. We don't want to throw the baby out with the bathwater and throw all of allopathy into the trash can. We want to realize that there's a time for all things, but right now, 99% of the people coming into the doctor's office are being prescribed synthetic drugs, etc. They're being prescribed what I would be doing in my fourth or fifth visit, minus results, and that rarely happens. So in my practice, 1 person out of 1,000 is getting a synthetic drug. The vast majority are being treated with homeopathy, naturopathy, psychology, exercise, energetic medicine, the QXCI, on and on and on, all in natural, and we're getting fantastic results with the most horrendous diseases. Where do we get our biggest problem? The more synthetic drugs they've been given, the more allopathic therapy they've been given, the harder our case will be, especially if it's cortisone. Any of those cortical steroids will create vast problems and upset the natural apple cart. We want to deal with symptoms. We want to deal with them naturally. And finally, down at the bottom, metabolic typing. Recognizing that people from different genetic backgrounds have different tendencies. There's a thing called constitutionals in our homeopathic form. People have different constitutionals. One person might have a different constitution than another. One person might have a different nutritional need, might need a little bit more B6, a little less B12. We have to realize that there's a flexibility and an individuality of medicine. We must lose here our statisticalness and recognize the magic of touching and sharing with the individual patient and working with their individual needs, both conscious and unconscious, which is what the QXCI has been developed. So here we have a new and proper form of medicine that I call the Nelson medicine system, and this is designed to take the place of the allopathic symptoms, because what most doctors are doing is just this. Most of the medical doctors in the world today are doing just this. Many of the acupuncturists and chiropractors are doing just this. This is being done by some nutritionists and exercise physiologists, but I'd like to see it accentuated even further. Very, very few people are dealing with this, except for maybe behavioral medicine people and etc. But I don't think that they're dealing with it at the level that they could. I believe that the heredity, that we can control and even adapt some of the heredity factors with homeopathy and with energetic medicine. So I wanted to bring this all into one big form of medicine that we could make it simple and easy to use. It sounds really complex. It sounds really like, oh, I'll go back to my allopathic method. It's so easy. You walk in, what's wrong with you? Boom, here, take a medicine, next. With the computer, with the QXCI, I've made a computer system that can allow us to address this with a patient in a 30 to 45 minute interview. Within 30 to 45 minutes, I can analyze all these things and work with the patient with the help of the computer system. Without that, it does become very difficult. But I think that the dream of natural medicine and the dream of a complete form of medicine is here, and it is coming, and it is something that we will change the world. So with this in mind, I've tried to build this CD to give you some information about the death of allopathy, and also to throw a little bit of what the positive message of medicine could be for the future. So with this in mind, I'd like to sign off. This is Dr. Nelson saying goodbye.